We now begin the program. I request our Honorable Vice Chancellor, Dr. C. Balachandran, to give the welcome address.
So, greetings from Tamil Nadu Veterinary and Animal Sciences University, Chennai, India. This university is well known for its veterinary teaching hospital in its different campuses, with MADRAS Veterinary College Teaching Hospital being the country's premier veterinary hospital with different specialty units and committed to excellence in diagnosis, treatment, and management of clinical problems. So, in this regard, I am happy to welcome the beloved speaker, Dr. Carolina, our organizing secretary, Dr. Balasubramaniam, the director of clinics, and the entire team supporting him, the participants, faculty members, and friends. So this veterinary transfusion medicine is slowly gaining momentum among the pet owners. Globally, there are only few veterinary blood transfusion centers and animal blood banks that are providing blood and components to the needy pets. In India, demand for blood and components has significantly increased in recent years. In India, the TANUVAS Animal Blood Bank was established as a basic canine blood bank during 2010 with blood collection and storage equipment. This is first of its kind and progressively developed into a state-of-the-art center with advanced instrumentations on par with human transfusion units. Currently, in 2020, the facility offers canine fresh whole blood, fresh frozen plasma, canine platelets, packed RBCs, canine blood typing, blood cross matching, and plasmapheresis procedures. On an average, 220 to 240 whole blood transfusions, 35 to 40 blood components, that is, fresh frozen plasma, platelets, packed RBCs per year are being carried out to the referral cases in our MADRAS Veterinary College Teaching Hospital. Moreover, the research activity funded by DBT, the Department of Biotechnology, is progressing towards the development of indigenous blood typing reagents for dogs. One of the recent highlights pertaining to the research support is a new initiative by DBT and the Ministry of Science and Technology to establish a canine research center and networks at TANUVAS at an overall cost of around 9.6 crores Indian currency, which offers a unique platform for interaction of the scientists and clinicians to work towards the welfare of the pet sector. The major thematic areas of research focus in this network include hematology and blood transfusion, oncology, control of major viral diseases, and its improved diagnostics and development of newer contraception approaches. To disseminate the research leads and expertise available in the network, DBT of Government of India has provided an opportunity to hold training and workshops in the major thematic areas of the network. The project monitoring unit of this CRCNN had conducted a hands-on national workshop on recent advancements on oncology and transfusion medicine in canine during March 2019. And a national symposium on current trends in contraception, with its opportunities and challenges for population control in dogs and cats during September 2019. Both workshop and symposium were well received and had diverse participants from different parts of the country and was very well done by the lectures that are provided by the technical updates as well as the hands-on demonstrations. In continuation of these efforts, the project monitoring unit of this network with information technology partner Alembic Pharmaceuticals Limited is now organizing this unique TANUVAS Global Veterinary Clinical Sciences Webinar 2020 on anemia and blood transfusion medicine in chronic kidney diseases in canines, that is open to all veterinary, undergraduate and postgraduate students, faculty members, field and practicing veterinarians worldwide to provide practical updates and an opportunity to interact with international experts. The webinar will focus on chronic kidney disease induced anemia, which is more prevalent and often encountered in small animals. In this context, I am happy to note that the organizing secretary and director of clinics, TANUVAS, has chosen Dr. Carolina, the right person with the expertise in the field of small animal transfusion medicine. I am confident that this unique platform of TANUVAS Global Veterinary Clinical Sciences Webinar 2020 will share knowledge amongst the budding veterinary students, faculties, academicians, and field and practicing veterinarians to tackle. I am very much impressed by the attendance. There are about 2,176 registrations from 29 states of India and 110 from 12 other countries. I'm really happy about what the response of this program will be quite useful based on this response what we got on this. I congratulate the entire team for organizing this unique global webinar and I thank the organizers for giving me this opportunity. Wishing all the best.
Thank you, sir, for the welcome address. And now we have a short clip about the Canine Research Center in networks for the next by the Alembic Pharmaceuticals video clip, and then we'll introduce the speaker, and by 7:15 the webinar starts. Let me introduce today's speaker, Dr. Carolina. She graduated from the University of Life Sciences in Lublin in the year 2014. During her studies, she completed a 3-month internship under the supervision of Claudia Provida, during which time she had an opportunity to participate in canine and feline hemodialysis. Since 2015, she has been employed at the Department of Clinic of Animal Internal Diseases, and she has participated in numerous training courses abroad at veterinary clinics, especially in Italy, Spain, Cyprus, and Great Britain, where she had the opportunity to learn about innovative methods of work and treatment, and participated in hemodialysis and performed kidney biopsy and echocardiography. From October 2017, she began her specialization studies in dog and cat diseases, certified by the Veterinary Continuous Education in Europe. From October 2019, she started the specialization studies in veterinary radiology. She has given several lectures in international conferences, and she has also been member of the scientific committee of the International Conference and Congress of the Polish Society of Veterinary Sciences. In 2018, she was awarded with the Scientific Award for the best paper in International Congress on Advances in Veterinary Sciences and Techniques. Her interests include kidney and heart diseases, cardiorenal access, and ultrasound imaging. She is the author and co-author of numerous scientific publications, which she has got including Journal of Veterinary Research and Veterinary Medicine and Science and Practice. She has also authored a chapter in a scientific monograph. This is her brief biodata. Now I request Dr. Karolina to take over.
It is my distinct pleasure to speak to you today and say a few words about anemia and blood transfusion medicine in chronic kidney disease in canines. Just a second, I'm sharing my screen now. My clinic was founded in 1955. Now there is the Innovative Center for Animal Pathology and Therapy. The clinic was founded in 1955. Now there is the Innovative Center for Animal Pathology and Therapy in the same place. And here is our great team. The head of our department, Professor Jacek Madany, who is ophthalmologist, cardiologist and nephrologist. Our neurologist, Dr. Beata Abramowicz. Our hematologist, Dr. Andrzej Milczak. And it's me, I'm keen on nephrology, cardiology and blood transfer. There are a number of definitions of anemia. Reviews provide comparison and contrast of them. A strict but broad definition is an absolute decrease in red blood cell mass. However, a broader definition is a lowered ability of the blood to carry oxygen. An operational definition is a decrease in all blood hemoglobin concentration of more than 2 standard deviations below the mean of an age and sex-matched reference range. It should be remembered that anemia is not a fundamental diagnosis in itself, and all possible steps should be taken to identify its cause. Once anemia is diagnosed, it should be determined whether it is regenerative or non-regenerative. And due to the pathogenesis, anemia can be divided into regenerative anemia. I see on your screen that it's not working. Maybe I make this like this. Due to pathogenesis, anemia can be divided into regenerative anemia, non-regenerative anemia, and iron deficiency anemia. And now we will say a few words about regenerative anemia. For example, it's hemorrhage after 38-96 hours and hemolysis. Hemorrhage may be external, often due to trauma, or internal. Any form of spontaneous hemorrhage with no apparent cause may suggest the presence of an underlying coagulopathy. The most common hemorrhagic presentations are epistaxis, hematuria, melena, hemoabdomen, hemothorax, and hemopericardium. About hemolysis, based on pathogenesis, hemolytic anemia can be classified as extravascular, its mean erythrocytes destroyed by macrophages, or intravascular, lysis of red blood cells caused by antibody complement complexes, drugs, and toxic compounds. Anemia is classified as congenital or acquired depending on the age of the animal, showing clinical symptoms. Hemolytic anemia may occur in dogs with Babesia, which is an infectious agent. I saw one very good publication from India, and I saw that Babesia gibsoni is very popular in your country. In our country, the most common is Babesia canis, and here in the center, you could see red blood cells with Babesia inside. Hemolytic anemia, and now we have got another example, immune-mediated hemolytic anemia in dogs. It causes severe anemia in dogs and is associated with considerable morbidity and mortality. In 2019, a consensus statement was published in which was described a novel tool for evaluation of evidence quality, using it to assess study design, diagnostic criteria, explanation of treatment regimens, and validity of statistical methods. Now we will say a few words about non-regenerative anemia. We could divide it for anemia of chronic disease, failure of the bone marrow, anemia of kidney disease, and now we will say more about this kind of anemia, hemorrhage or hemolysis, the first 38-96 hours, and anemia associated with endocrine dysfunction. We have also iron deficiency anemia. It is anemia with a variable regenerative response. Iron deficiency anemia could be regenerative or non-regenerative. And how could we cure it? We could give to the dog iron dextran, 10 milligram per kilo intramuscularly every 3 weeks, but we have to remember that it could be painful for the dog. We could also try to give it orally as ferrous sulfate from 50 to 300 milligrams total dose every 24 hours. It should be given an hour before feeding to maximize intestinal uptake and should not be administered with antacid, such as calcium carbonate. Here we have got types of anemia from another book, and also we could see the difference between healthy dog's blood, here on the left side of the screen, and dog with anemia. Chronic kidney disease. Chronic kidney disease occurs commonly in older dogs and cats and is the most common renal disease occurring in elderly patients. Chronic kidney disease is thought to affect from 0.5% to 1% of geriatric dogs and from 1% to 3% of geriatric cats. It is defined as structural and/or functional impairment of one or both kidneys that has been present for more than approximately 3 months. In most patients, there is loss of function and structure with chronic kidney disease. However, degree of functional impairment does not always mirror loss of structure. Chronic kidney disease implies irreversible loss of renal function and or structure that remains stable for some period of time but is ultimately progressive. Azotemia does not develop until 75% or more of the nephron population has become non-functional. Isostenuria occurs when greater than 66% of the nephron population has become non-functional. The ability to elaborate maximal urine concentration is lost earlier. Therefore, I believe that urine is a treasury of knowledge for us, practitioners, and that this test should be frequently used in clinical practice. What is IRIS? IRIS is an international special interest group seeking to identify and disseminate information on better methods for the diagnosis and treatment of dogs and cats with renal disease. I had the opportunity to do an internship with one of its members, Dr. Claudio Brovida, thanks to which I had the chance to participate in hemodialysis treatments in dogs and cats with renal failure. This is a photo of the board meeting in 2018, and Dr. Brovida is the fourth person from the right with black hair and a black mustache. IRIS has proposed a staging system for chronic kidney disease based on the serum creatinine concentration or on the blood SDMA concentration, or preferably both of the stable patient on at least 2 occasions. A substage then is assigned based on whether or not the animal is proteinuric and the absence or presence and extent of hypertension. Staging of chronic kidney disease should allow more rational treatment strategies to be employed based on stage of disease. The goal of treatment is to slow or prevent progression of disease. And here we have got IRIS staging of chronic kidney disease modified in 2019. And here we could see that we have got 4 stages. The level of blood creatinine is in blue color, and the level of SDMA in brown color. So in the first stage, we have got the normal blood creatinine or normal or mild increased blood SDMA, some other renal abnormality present, such as inadequate urinary concentration ability, without identifiable non-renal cause, in cats, not dogs. Abnormal renal palpation or renal imaging findings. Proteinuria of renal origin, abnormal renal biopsy results, increasing blood creatinine or SDMA concentration samples collected serially. Persistently elevated blood SDMA concentration, more than 14 microgram per deciliter, may be used to diagnose early chronic kidney disease. And in dogs, the level of creatinine is less than 1.4, in cats less than 1.6. In the stage second, the level of creatinine for dogs is from 1.4 to 2.8, and in cats from 1.6 to 2.8. It's normal or mildly increased creatinine, mild renal azotemia, lower end of the range lies within reference ranges for creatinine for many laboratories. But the insensitivity of creatinine concentration as a screening test means that patients with creatinine values close to the upper reference limit often have excretory failure. Mildly increased SDMA, clinical signs usually mild or absent. We have also the first stage of classification. The level of creatinine is from 2.9 to 5 milligram per deciliter in dogs, and from 2.9 to 5 milligram per deciliter for cats. It's moderate renal azotemia Many extrarenal signs may be present, but their extent and severity may vary. If signs are absent, the case could be considered as early stage 3, while presence of many or not systematic signs might justify classification as late stage 3. And the last stage, the stage 4, when the creatinine is very high value, more than 5 milligram per deciliter in dogs and cats, it's increasing risk of systemic clinical signs and uremic crisis. Blood creatinine levels depend on several factors, mainly muscle mass. Therefore, we will interpret it differently in the American Staffordshire Terrier than in the miniature pincher. Now we have got substaging by proteinuria. The goal is to identify renal proteinuria, having ruled out postrenal and prerenal causes. Standard urine dipsticks can give rise to false positives. Therefore, practitioners should consider using a more specific screening test, such as the urine protein to creatinine ratio of a species-specific albuminuria assay. Canine and feline patients that are persistently borderline proteinuric should be re-evaluated within 2 months and reclassified as appropriate. And is the second substaging by blood pressure. So canine and feline patients should be acclimatized to the measurement conditions and multiple measurements taken. The final classification should rely upon multiple systolic blood pressure determinations, preferably done during repeated patient visits to the clinic on separate days, but acceptable if during the same visit with at least 2 hours separating determinations. Patients are substaged by systolic blood pressure according to the degree of risk of target organ damage and whether there is evidence of target organ damage or complication. For most dogs and all cats, the iris blood pressure substages are as follows. However, some breeds of dogs, particularly Siamhounds, tend to have higher blood pressure than other breeds. And we have to remember about this. The blood pressure is higher in these dogs, about 10 mmHg than other breeds. And now we will say something more about anemia in chronic kidney disease. Non-regenerative, because reticulocytes are less than 1%, normochromic, normocytic, and hypoproliferative anemia is common in chronic kidney disease, but variable in severity. The severity of anemia correlates positively with serum creatinine concentration, and clinically relevant anemia is a hallmark of patients with International Renal Interest Society, chronic kidney disease stages 3rd and 4th. Anemia may be masked by dehydration, which causes hemoconcentration. Thus, the hematocrit should be evaluated in conjunction with the serum total protein concentration. The pathogenesis of the anemia of chronic kidney disease is multifactorial. The primary cause of anemia in chronic kidney disease is decreased production of erythropoietin by the diseased kidneys, so that the uremic patient cannot meet the demand for new red cells necessitated by loss from hemolysis, hemorrhage, and normal turnover. Erythropoietin stimulates the final differentiation of committed erythroid progenitor cells in the bone marrow into mature red blood cells. The lifespan of red cells in uremic patients is approximately 50% that of healthy individuals. The decreased lifespan is thought to be due to a toxic factor, possibly PTH, in urine plasma that promotes hemolysis. Parathyroid hormone may play an important role in both inhibiting hematopoiesis and causing hemolysis. Increases in serum phosphatase and erythrocyte 2,3-diphosphoglycerate concentration may compensate for the anemia by providing adequate tissue oxygenation even at low hematocrit value. Platelet dysfunction promotes insidious ongoing blood loss, and some dogs and cats with chronic kidney disease have microcytosis and iron deficiency based on evaluation of serum iron concentrations. However, many human patients also develop anemia in association with iron deficiency and/or intestinal bleeding. During our stay at the International Congress in Lviv, Ukraine, we saw ferrisaccharate solution in the museum's pharmacy. The production secret of this product dates back to the 16th century. Then, after experiments on the creation of the elixir of youth, the well-known alchemist at that time created a product that had a very positive effect on the renewal and regeneration of blood cells. Nowadays, iron wine is used to treat anemia caused by the lack of iron in gastritis and peptic ulcer disease. What else could we see in hemogram? We could see major neutrophilia and lymphopenia. Normal platelet numbers, but platelet function may be abnormal. Abnormalities of platelet function include abnormal platelet aggregation, abnormal platelet factor first release, abnormal platelet adhesiveness, decreased clot reaction, and decreased thromboxane production by platelets. All treatments for chronic kidney disease need to be tailored to the individual patient. The following recommendations are useful starting points for the majority of dogs at each stage. Serial monitoring of these patients is ideal, and treatment should be modified according to the response to treatment. We can note here that in the recommendation for stage 3, analogically also to stage 4, the group included recommendation for the treatment of anemia. And this is, I show you this recommendation. So consider treatment for anemia if it is affecting the patient's quality of life. Typically, this occurs when the PCV is less than 20%. Human recombinant erythropoietin is the most effective treatment, but is not approved for veterinary use. Darbepoetin is preferable as it is less antigenic than epoetin alpha. Anabolic steroids are of no proven benefit and may be detrimental. So now we will say something about recombinant human erythropoietin, about EPO. So effects in treated dogs and cats. Regression of anemia, weight gain, improved appetite, improved hair coat, and improved sociability with their owners within a few months of treatment. Because of the development of anti-human EPO antibodies, human recombinant EPO treatment should be reserved for dogs and cats that have severe transfusion-dependent anemia, and we have to remember about this. So consider symptomatic dogs and cats with PCV less than 20%. The starting dosage is 100 units per kilo subcutaneous 3 times a week. When PCV is more than 30%, reduce dose to twice a week. Iron supplementation should be provided during and ideally before treatment to ensure that the animal is iron replete. And here we have got doses from 5 to 50 mg per day orally. Administered iron may be poorly tolerated, and intramuscular iron dextran given every 3 or 4 weeks in dose 50 milligrams per cat and 10 to 20 milligrams per kilo for dogs. Iron dextran administration may be painful, and iron dextran should not be given intravenously as there is a risk of anaphylaxis. Hematocrit must be monitored closely during therapy. Always measure the hematocrit by the same method, or if you are sending by the same laboratory. PCV target range is from 30 to 40%. Recombinant human EPO is not approved for use in animals. There is from 20 to 50 risk of anti-erythropoietin antibody formation. Antibodies tend to form 30 to 90 days after initiation of therapy. Other adverse effects observed during treatment of dogs and cats with recombinant human erythropoietin include vomiting, seizures, hypertension, uveitis, and mucocutaneous hypertensivity-like reactions. Here is a very good publication in Journal of Veterinary Internal Medicine. The use of darbepoetin to stimulate erythropoiesis in the treatment of anemia of chronic kidney disease in dogs. Because epoetin alpha was the first erythropoiesis stimulating agent used in human and veterinary medicine, but it has largely been replaced by darbepoetin alpha due to a 3-fold longer half-life, allowing for less frequent dosing. Darbepoetin is a hyperglycosylated synthetic recombinant human erythropoietin analog. A previous study investigated the efficacy of darbepoetin in cats with anemia secondary to chronic kidney disease. 14 of 25 cats responded, with 13 of 14 responding cats receiving a dosage of more than 1 microgram per kilo per week subcutaneous. Recommended dosing in dogs is extrapolated from human and feline medicine and ranges from 0.45 to 1.5 microgram per kilo per week subcutaneous until a target packed cell volume is achieved. In our clinic, in practice, we use the dose 0.45 from 0.45 to 0.8 microgram per kilo per week. The therapeutic targets for PCV currently published range from 25 to 40%. Once the target PCV is achieved, dosing is decreased in frequency to the longest interval that maintains the target. The purpose of this study was to respectively evaluate the effectiveness of darbepoetin to stimulate erythropoiesis and correct anemia in dogs secondary to chronic kidney disease. Additional goals were to describe the dosage protocols used for administration of darbepoetin and to document the prevalence of associated adverse events. So what was the conclusion and clinical importance? Darbepoetin, when combined with treatment of comorbidities, is an effective treatment for anemia secondary to chronic kidney disease in dogs. Pure red cell aplasia was a possible adverse event in 2 of 33 dogs. It was 6%. And now I will say something about transfusion medicine, followed by the clinical case. Our patient was dog, Cane Corso, female, 12 years old, named Junia. The dog had been treated in a private clinic for about a month and had a clinical consultation in Department and Clinic of Animal Internal Diseases, as her condition was deteriorating. Presented with symptoms of apathy, decreased appetite, weight loss, polyuria, polydipsia, and vomiting. After clinical examination and blood examination, classified to stage 3 of chronic kidney disease by iris staging of chronic kidney disease. In hematology, our attention is drawn to the red blood cell system. Here we have got these values. Red blood cells, hemoglobin, and hematocrit fall below reference ranges. The hematocrit was about 15%, so we decided about blood transfusion. And it was the question to my student. It was first transfusion of dead dog, so should I test blood type or not? Because we know that we haven't got naturally occurring antibodies, then why I am wondering? Because we know about delayed immune response to transfusion, prevention of a potential lethal hemolytic reaction, and we have to remember that DA1 plus blood for the dog DEA1 minus induce sensitization and production of antibodies. We have a few methods for determining blood groups. The first one is platelet aggregation test. The second one is quick test Alvedia, and in my opinion it is the best test. I show you this test here, how it looks like. We have got also gel method. This method is very good but labor consuming. So it was the blood for our dog. You could see on the picture that the blood was DA1 positive. And we have to remember about this, that if we have got DEA1 positive blood for the dog with DEA1 negative, we could induce sensitization. So we did the blood group report of our dog. So fortunately, Junior was DEA1 positive dog, so we haven't got problem with the transfusion. Here we can, how much to give. I think the practitioners will be very interested about this. It is a very good paper. It was published in Journal of Veterinary Emergency and Critical Care about accuracy of formulas used to predict post-transfusion pack cell volume rise in anemic dogs. In this article was 4 formulas. Here I show you 2 of them. In my opinion, the best, the most correct. And we have got a practical example. Here we have got blood formula and example of estimation of volume required in blood therapy. So the dog had 30 kilograms, PCV was 10%, desired PCV was 20%, and donor blood PCV was 50%. We use this formula, we count it, and totally we should give to dog 540 ml of blood. And please remember the general rule, the 2 milliliters per kilo of all blood will rise the PCV by 1 percentage point or the hemoglobin level by 0.3 gram per deciliter. And here I have for you some tips about blood transfusion. Please to remember that all blood products should be administered through a filter. All blood products always administered through a separate catheter. Products should be brought to room temperature prior to administration. And please never give with fluids containing calcium. In an emergency, blood may be administered at any rate. If it's not an emergency, blood administration is initially slow, 1 milliliter per kilo per hour. The first 15-20 minutes are the most important. Diagnosis of an early post-transfusion reaction, and administration of the remaining blood within 2-4 hours. The monitoring of blood transfusion is very, very important. Here I showed you transfusion monitoring chart. Here is the time of the transfusion. So after 15, 30, 45, 1 hour, etc., we check temperature, pulse rate, pulse quality, respiratory rate, CRP, blood pressure, systolic, mentation, vomiting, dyspnea, and other symptoms. Blood is a very good medicament, but also we need donors to reach the blood. So donor selection and criteria in dogs. So the dog should has more than 25 kilos. He should be healthy, calm, DEA 1.1 minus, and negative for infectious diseases like Anaplasma, Babesia, Brucella, Ehrlichia, Hemobartonella, Leishmania, and Trypanosoma. Also, I would like to say a few words about cats. How is the donor selection and criteria in cats? So, cats should be in good health, no cardiac murmur in osculation, weigh at least 4 kilos, be fully vaccinated, indoors, be free of parasites, screened for fever and Mycoplasma haemophilus, have a pack cell volume of more than 35%, not be pregnant or lactating. Donor cats should have a calm disposition. In cats, we have 3 blood groups. The first one, most common, is blood group A. We have got also blood group B, very rare, and AB, extremely rare, can be donors. It should be noted that there are significant breed and regional differences. Siamese cat in 100 blood group A, British Shorthair and Devon Rex in about 40% group B, and domestic Shorthair about 95% blood group A. And cats with blood group B potentially have antibodies against group A. Blood of group A given to a cat with blood group B causes serious reactions, approximately 30% fatal. Blood group B given to A blood type cat will cause moderate reactions, and we have to remember about it. Cross-matching identifies serological fertility between donor and recipient. Please watch for signs of hemolysis or agglutination. Of course, we have to remember that sometimes the cause of kidney failure is completely different than with dog. Here is very good paper and by Professor Pouchelon and from France, the School of Alfort, and another very famous cardiologist and nephrologist. Cardiovascular renal axis disorders in the domestic dog and cat, a veterinary consensus statement, It was published in 2015. And what is in this paper? There is a growing understanding of the complexity of interplay between renal and cardiovascular systems in both healthy and disease. The medical profession has adopted the term cardiorenal syndrome, CRS, to describe the pathophysiological relationship between the kidney and heart in disease. CVRDH refers to kidney injury or dysfunction emanating from a primary disease process involving the cardiovascular system. Potential mechanisms of CVRDH include decreased kidney perfusion, secondary to decreased cardiac output, activation of neuroendocrine system, namely the renin-angiotensin-aldosterone system, RAAS, and sympathetic nervous system, SNS, generation of reactive oxygen species by abnormal or injured endothelial tissue, and passive venous congestion of the kidney. So here is our clinical case. It was dog. The first was problem with the heart, and here in the ultrasound of the heart we could see left ventricle, left atrium. The left atrium is bigger than it should be, and here is mitral valve. The mitral valve, in fact, the mitral valve with myxomatous mitral valve disease. And post-mortem, we could see once again the mitral valve of these dogs, and we could see here nodules. Secondarily to the heart was kidney failure. We could see that kidneys are small and they haven't got correct structure. And I have for you, last but not least, clinical case. It is domestic short-haired cat named Zuza, 10 years old, 3.5 kilos. Refer to the clinic, our clinic for consultation with clinical, hematological and biochemical examination, urine test and clinical symptoms observed in the course of chronic kidney disease. We made ultrasound of the abdomen of this cat and we saw kidney. Here I show you where is kidney. With a lot of cystic inside with fluid. So here was the polycystic kidney disease, which is a genetic disorder. Persian cats are a predisposed breed, but it also occurs in domestic cats. Where our Polish-Indian friendship began. In September 2019, at the Pisa University in Italy, I met Dr. Baranidara. He was a guest of Professor George Lubas, who ran blood bank at Pisa University, and here on the picture is Pisa University. We are impressed by the work that the TANUVAS transfusion medicine and blood bank does, so we want to establish cooperation between Tamil Nadu Veterinary and Animal Sciences University and University of Life Sciences in Lublin, that in the future will result in academic exchange between our universities, also as part of the Erasmus Plus program. From this place, I would like to thank Dr. Baranidaran for his organizational help, substantive consultation and support. I would also like to thank the organizing committee, Dr. Balachandran, Dr. Balasubramanian, Dr. Tirumurugan, Dr. Baranidaran, and Dr. Santos Singh for the invitation and the opportunity to speak in front of such a large group of doctors. Thank you very much, and here is my cat who actively supported me in preparing this presentation. And excuse me for small technical disorders, but to be honest, I don't know why it's not working.
Shall we go for the question and answer session, Dr. Carolina?
She's ready. Good day, she's ready. Right? There's a camera.
Are you ready for the question and answer session, Dr. Carolina?
Yes, I am ready.
So, first of all, we were impressed with your talk that gave us a lot of insights in small animal transfusion.
Thank you very much.
Especially the kidney-related issues where we have a lot of cases in India, and for which we give ESAs, erythropoietin-inducing agents. That was a wonderful talk on that too. So yeah, the participants have a lot of questions, so I'm going to filter and moderate the practical questions, and you might have to answer one by one. So Dr. Gurudev Singh from Gurdaspur, India, is asked, please guide about fluid therapy and most important medicines for CKD.
The most important medicine, I think that in chronic kidney disease, the most important is the reason of the chronic kidney disease. If we ruled out post-renal and pre-renal causes, and we are sure that, for example, it's a glomerulonephritis or another case. So we give antibiotic, we give, of course, fluid therapy, and in my opinion, the best fluid in kidney disease, and the same is in a lot of articles, it's ringer with lactate. We have got the best treatment with this, and it's very important. Also, we give, when we have got vomiting cats or dogs, we give maropitant, anti-vomiting. We give also omeprazole, and I think that's all. Of course, it depends. If we have got, for example, the blood pressure is more than 160 systolic, we give for a cat amlodipine, because the best result is with amlodipine by cats when we have got higher blood pressure. And for dogs, we give AC inhibitors. And the same, we have got proteinuria, we also give AC inhibitors. But in cats, also amlodipine is working very good, and later we would be the smaller protein urine.
Yeah, thank you for that. And to answer Dr. Gurudev Singh's question, it is an oceanic subject, and you will have to read at least 40 pages of Ettinger, because it's a broad question. So the next one comes from Dr. S. Rangasamy. He is asked about simple method of blood transfusion at a field level.
Sorry, because I didn't hear the last words. Simple method of the blood transfusion in
the field level. Here in the field level, we mean we don't have much of equipments, and blood bags and
For example, we could take the blood for our own dog. For example, my friend yesterday, she took her own cat to take the blood from the dog, and she used citrate put to the special bag, and she made transfusion directly from one cat to the other cat. And also sometimes but this is in emergency medicine, because I'm also working in emergency medicine at night. Sometimes we make auto transfusion. If the dog or cat after the accident lose a lot of blood, we could also take this blood and give to the dog.
Yeah. So the next question is from Kulwar Deep Singh from a place called Satna. So his question is whether chronic kidney diseases, are NSAIDs to be given or not to be given?
Once again, because I don't hear it, something I think with maybe with the transfer, because I don't hear. Or if you could write me on the chat, because something is stopped on my stream.
Non-steroidal anti-inflammatories, can it be given for CKD cases or no?
Hello? Sorry, do you hear me?
Yeah, I hear you. Do you hear me?
Okay, yes, now I hear you.
Can non-steroidal anti-inflammatories be given for kidney diseases or no? If no, why?
I don't know what happened. Could you write me on the chat? I think it will be easier.
Yeah. Am I clear, Dr. Carolina?
Yeah, but maybe you could send me a message, for example, on the chat, and I could read it. Because something is maybe, because I hear you good, but sometimes it stopped.
Okay, I will just type it now.
Okay, it will be perfect.
So in India, we use minimal non-steroidal anti-inflammatories for a lot of cases. So,
Okay. Now I see the question. Yeah, about NSAID given for CKD. To be honest, when we have got chronic kidney disease, when we do you hear me well now? Yes. Okay.
yeah,
So
the whole world is listening to you.
okay. So when we have got the chronic kidney disease, the dog or the cat is still dehydrated. So we don't give NSAID in chronic kidney disease, because we could make bigger renal failure. And in my opinion, and it is my suggestion, because I use in my practice, for example, opioids, they are very good. For example, buprenorphine or turbogesic, or sometimes methadone. So it's better use opioids than NSAID. The same I was on the training in England in one of hospital emergency, and then they made the same. They gave opioids, but not NSAID, because they were afraid about consequences and failure of the kidneys.
Yeah. One of our former deans, Dr. L. Gunasilan sir, has asked a doubt. He was just asking whether the transfusion talks will be only related to kidney diseases or not. This is before the webinar.
Once again?
The question is, is the anemia chapter only linked to kidney diseases?
I think that about anemia, the specialist is Dr. Baranidaran. So I will be happy if you would like to answer on this question because you are a specialist in anemia.
One of our lovely questions, I would say, from Dr. Ganesh Klaus from a place called Buldhana, India. He's asked, what are the kidney worms of a dog?
Could you write me this? Because it's something with the stream and it's better for me if you write it.
I will go slow. We are typing anyway. He's asking about any kidney worms possible. Worms in the kidney.
No. Could you write this, please, for me? It would be perfect if you could write this on the chat because it's better for me. Worms possible of the kidney. Okay, in Poland we haven't got, but I hear because I was on the, I had the lecture with people from Romania, and in Romania it was one kidney which is in the kidney medulla. If you want, I could, because now I don't remember of the name of this worm, but I could check it and I could write to the doctor. So if he will write to me email or put the email address here on the chat. Later I send him this worm. Because also the Poland was endemic of this worm, but I think 5 or 10 years ago, and also this worm was in the humans. They saw doctors in humans, but we haven't got examples in dogs in Poland. But I know that in Romania it was this accident, and if you give me more time, I will check the name of this worm because it's in Latin, and I don't remember.
Sure, we will send you the email address of the particular person and you can share your opinion.
Yeah, and I will be happy to answer exactly what it was the name of this kidney. It was in kidney medulla. It was the best place for this worm.
There is one more question from Dr. Chavi Gupta from Tirunelveli Veterinary College. He's asked what is the best biomarker for CKD?
It is a very nice question. Thank you very much for this question because I'm interested in biomarkers in chronic kidney disease. Now I make very good research about this. And in my opinion, because we know that creatine is not good marker because the creatine level is higher when we have got 70-75% destroyed kidney. SDMA is faster catch the failure of kidney because when it's about 25-30% destroyed. But now I'm making clinical about NGAL, in my opinion, and from my NGAL, neutrophil gelatinase, and also KIM1. It is a very fast marker in chronic kidney disease, and they are faster than even SDMA in chronic kidney disease. If you want, I could put on the chat the names, because I know that sometimes, because it's a lot of kilometers between us, and sometimes is the problem with the connection with the stream, so I put now this on the chat box. And of course, vitamin C.
So the next question is from Dr. M.
Okay, I sent it to you.
Yeah. Dr. Palnivil Rajan from the Wildlife Sciences has asked a question.
Mm-hmm.
Can you give a gist of any blood transfusions done in exotic animals?
No, to be honest, I'm not keen on exotic animals. We have got one specialist at our university, but I didn't hear that he made a transfusion for exotic animals. We keen really on dogs and cats in our clinic. So sorry, and I don't know. Maybe they did in our clinic, but it's not my department.
So I'm sure that you're going to love this question. How does chronic kidney disease affect heart?
Affecting the heart? Affecting the heart because it's how to say this? Its connection with the pressure. Because when we have got kidney disease, also the pressure in all our organism is higher. And secondary to this, it's affecting the heart. This paper is very good because the answer for this question could be very, very long. And really, I recommend you this paper because it's you could see that step by step they say about these possibilities.
So probably we could mention the term called cardiorenal syndrome so that they can read about it.
It's, sorry?
The cardiorenal syndrome?
Yeah, the cardiorenal syndrome. What about cardiorenal syndrome?
Yeah, they can read about that. Is that okay?
Yeah, it's. I don't hear you. It's something stopped.
Okay, here is one Dr. Dasarathi Lalita from Chennai. She is asked, at what level of hemoglobin do we consider that the dog needs transfusion? She is asking about transfusion triggers.
About transfusion, about the level of hemoglobin, to be honest, also the status of the dog is very important, and we care really about the status of the patient.
Yeah, she is asking the hemoglobin level when to wait.
Level to reach in transfusion?
Yes. What levels of hemoglobin can we wait before we do transfusion?
So, for example, when we have got the 5, for example, the level of hemoglobin, we are making the transfusion mostly. But to be honest, it depends if it's a dog after accident, or if it is the dog with hemolytic anemia, or if it is a dog with a chronic disease like chronic kidney disease. So I couldn't say you a one number, because it depends also from the status of the dog.
Yeah, so I think the next question, Dr. Subir K. Mohan has asked from Trishur. I think a director of clinics will answer this. Is there an e-certificate for this program?
Is it, once again?
No, the question is for the director of clinics here. Dr. Subir K. Mohan from Trishur. Is there an e-certificate for this program?
Yes, it is certificate for this program, yeah.
See, I'm happy that you asked the question. The first thing is you should be online and listen to the complete session, then probably you get the certificate. Unlike other programs, you just register and then go out of the scene and you generate one e-certificate. That is not possible here. So if you are online till the completion of the session, then you receive the e-certificate. The certificate will be different when compared to other programs also. So hopefully you will receive the certificate in a day or two.
Dr. Vijayan from Trivandrum, Kerala, he has asked a beautiful question. So, can we do a blood transfusion along with dialysis?
Along with dialysis, no. I have never made something like this. Firstly, we make blood transfusion, and later we make hemodialysis. It is my practice, and I took this practice from Italy, from Dr. Brovida, who makes really a lot of blood, a lot of hemodialysis. So it is the rule.
Okay, Dr. Kumar Sardar from Bhubaneswar. His question is whether plasma volume expanders can be administered in CKD dogs.
If could be plasma administered in CKD dogs, to be honest, in our clinic we give blood, not plasma, but it's possible. But in my opinion, it's better the blood transfusion.
Dr. Virampal Singh from Jammu has asked a question. What is the role of cystatin C in CKD? You have
the role of cystatin C, it say us where the glomerules are destroyed. Exactly, where if glomerule, because you know that we have got glomerulonephritis, interstitial kidney disease, we have also disease connected with medulla, and cystatin C say us exactly if we have got the problem with glomerulus in nephrons. Only this part, it say us only about this part in nephron.
So there's one more vet who has asked that which part of the world are dog renal transplants being done?
Once again about dog renal transplant, but the first was the first word from the question because I didn't hear.
Which place are they doing renal transplants?
Renal transplant in dogs. In Poland, we don't do this. I spoke about this also in Italy, and I think that European Committee is not agreed with renal transfer. I hear about one case in Poland, one veterinary clinic, but in my opinion, it's not so ethical, and because also about immune-mediated of dogs. It's not so like in the cats. In my opinion, the transfer, the renal transplantation is easier than in cats than in dogs. And also, I know that then in America they made transplantation in cats. They have got special program. They took cats from the Society for Cats, and later the owner has to adopt this cat. But also because last year was one conference with one of specialists from America in Poland, and they say that they don't do this more.
So our Professor Dr. L. Nagarajan will share his views on this.
Hi, I'm Dr. Nagarajan, Professor of Surgery in vet school here. To my knowledge, there were some transfusion programs in state in the US, especially in cats. Because a long time ago, I had an interaction with Dr. Byron Stanley in Michigan State University. And he said the post-operative care is very intense. So I guess she was trying to do this renal transplantation long time ago, and they stopped the program. The only thing that to my knowledge, is that I'm not sure if they still do it in Penn State. That was going on some time ago, that too in cats, not in dogs. Thanks.
Thank you, sir. Do you know about any ethno-veterinary medicine for CKD?
Sorry, once again?
In India, we practice something called ethno-veterinary medicine.
Could you write me this question, please? Because it's now something with the streaming.
there's one Dr. Basanti Kumari from Ranchi, India. He's asking whether human blood can be transfused to any animal.
One moment, I try without my headphone because maybe will be better. Oh, could you try once again to say the question, because maybe now it will be the better stream. Could you try?
Yeah. So can human blood be given to another animal?
Just a second. Could you write me this please on the chat box? Because I don't know, but I don't hear. It's no veterinary medicine practice. What does it mean, it, no? What do you understand because of this it, no? Herbal medicine. To be honest, we don't use in our practice herbal medicine for chronic kidney disease. I'm thinking about this, but
it's not an issue. We can always email the participants on the.
Yeah, because it's one supplement, but it's not the medicine. It's supplement. We could give the supplement to the food of the dog, but to cure by herbal medicine, no, we don't use it.
Yeah, so thanks a lot. The other question seems to be all repeats again. So that was a wonderful question and answer session, Dr. Carolina. So I request Dr. Tirumurugan to present the vote of thanks.
Dr. Carolina.
Yes.
We had a nice lecture from you.
Thank you very much.
Interesting. And as you know that the number of participants here, no?
No.
2,418.
Oh my God.
More than 50% were online. And many people from almost 12 foreign countries and more than 29 states in India were viewing your lecture. And to be very short and brief, you'll become a celebrity.
Thank you very much. I'm really impressed. It's good that you didn't say this to me before the presentation, because I will be stressed like a stone or something. But thank you very much for your attention. Thank you very much for your interest. It was the pleasure to say something about kidney disease, and I hope that I gave you some practical also tips.
Certainly, certainly.
It's our formal duty to propose the vote of thanks. We take this opportunity to thank Dr. Carolina for sharing her time and her expertise. We take this opportunity to thank our Honorable Vice Chancellor, Dr. C. Balachandran, for all his support, and Dr. S. Balasubramanian, the Director of Clinics, for providing this innovative platform to share this knowledge gained. We take this opportunity to thank Dr. Karnanadi, Vice President Alembic, and the Information Technology Partner Alembic for this platform to go on without any hitch. The entire team of staff at the Project Monitoring Unit of Canine Research Center and Networks at TANUVAS, the funding agency, the Department of Animal Biotechnology, Government of India, and not least, the interested participants globally who have taken time to log into this clinical webinar series. Thank you one and all.
Thank you very much.
Now I request Dr. Karnanadi, Alembic, Vice President of Alembic, to speak a few words.
Okay. Good evening, one and all. It's a great pleasure. If I have to say a few words about this webinar, as you know, TANUVAS started as a veterinary college in 1903, almost 117 years back. And Alembic is also a century-old company and started in 1907. So 2 century-old institute or the company joined hands together to conduct this webinar. TANUVAS as a knowledge conducting this webinar, and Alembic being a technology partner. We have visited this TANUVAS Madras facility many times. The facilities for the different specialties like cardiology, ophthalmology, dermatology, internal medicines, like in human being, what kind of specialties are there? Almost all the specialties are covered in the veterinary practice also. And TANUVAS is known for developing new therapy areas, particularly for the stray dogs for the mass sterilization, active polymer technology by single injection by intravasal route. So such a premier institute has given an opportunity for us to participate in this. And also the Canine Research Center and Network, a Government of India sponsored program, which is also situated in the same campus. So we are very happy to be a partner in this. At this moment, I would like to thank Vice Chancellor, Dr. Balachandran, and also Director of Clinics, Dr. Balasubramaniam, and other veterinarians who are part of this program from this Madras Veterinary College. Thank you very much, and thank you for all the participants. Thank you.
Thanks a lot to all the participants, and I should sincerely thank our Director of Clinics, Dr. Balasubramaniam, who is actually all efforts to make this dream come true. It was a beginning of our global veterinary series, and you're going to see lots on the forthcoming months. Thank you, one and all.